Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
And today we are talking about Lima, New Bremen, and Spencerville Dental Associates. So that means with us in the studio is Dr. Wesley Shankland. Good morning to you again, Wes.
Hi, George. How are you today?
I'm doing
Great.
just terrifically. I understand you want to talk something about dry mouth.
Dry mouth. It seems kind of funny to talk about, but I don't know if you've ever had that problem, but it's it's just difficult. You have dry mouth. It's not uncomfortable, but it doesn't painful, but it is uncomfortable. It's difficult to talk, and right now I have a little bit of that because I'm just terrified to be on this TV show. No, but I have a little bit of that because I'm taking an antihistamine because of all the pollen in the air.
Yeah.
Dry mouth is a real problem for people. It causes their gums to dry out, a lack of salivary flow or saliva in the mouth, can't wash the teeth, can't begin the digestion of food. And a lot of this happens because of over 400 types of medication we have in our United States alone that can produce dry mouth. Also, people who have had cancer, especially those who've had cancer and had radiation therapy, they have damage to the parotid glands primarily here, which produce most of our watery saliva. And because of that, their mouth is dry. So they have dry gums, they have deposits on their teeth even if they brush their teeth. They have severe decay because at nighttime when you sleep, your salivary flow slows down, and so deposits on the teeth can produce decay with bacteria in your mouth. Like I said, there's halitosis or bad breath with that. Even though they brush really well, it's very difficult for people to have dry mouth to keep their mouth refreshed and keep it clean, and so it doesn't have an annoying smell and a sour taste.
How do you go about combating all that?
Well, it's hard. You may talk to your physician about the medications. I've called medical doctors and asked if they could switch medications, and sometimes they can, and that doesn't cause that problem. But also they could sip water, just sip water throughout the day, and stay away from spicy foods, and some people think caffeine may cause a problem. Definitely smoking and alcohol consumption can dry this out. And, but I find one of the best things, there are all kinds of things you can buy at the store to increase the moisture in your mouth, but Xylomelt, X-Y-L-I melt, Xylomelt I found is the best. And people can have that in their mouth during the day or nighttime. It sticks to the cheek, slowly dissolves, and produces salivary flow and stimulates your parotid glands to give you saliva. So you have to wash your teeth with the saliva. If the mouth is dry, you have some problems there. So dry mouth is a very difficult thing. Discuss that with your dentist and your hygienist.